Hi, welcome to the Optimum Tide. I'm Anastasia Jaegerman. Today, we're going to talk about ketamine. First thing first, out of the gate, let's clarify that ketamine is an FDA-approved drug. And today, we have Dr. J with us to talk about ketamine and all the questions we have or we might have about this FDA-approved drug. Welcome, Dr. J.
Thanks, Anastasia. Yeah, I think it's high time that we talked about ketamine. So why don't you start off the session and let's see what we can discover today about the benefits of ketamine.
I have tons of questions for you. We know that psychedelics have actually made a reinsurance or a renaissance, but ketamine has been approved by the FDA for quite some time. And tell me, what is the primary use of ketamine?
Well, ketamine has been used for a long time for anesthesia. It's an excellent drug for anesthesia, and it helps with pain control. For people that get procedures done, things like setting a fracture, people that have burns that have to have dressing changes, things like this. So it's been used very safely for many years as in anesthesia to help with control a lot of problems.
So in a control setting and in a hospital?
In a hospital, yes. I think one of the things that we should talk about right from the get-go is that ketamine is only used under supervised conditions. If somebody that a doctor or someone in the healthcare industry that knows what they're doing would be the one that would administer and then supervise you under the treatment that you were receiving of ketamine.
Okay, let's talk about the different kind of modalities because I've been exploring. I did some research on this because I went to a ketamine clinic in Dallas. And as we know, there are ketamine clinics all over the United States. I don't know if there's some in the state of New York?
There are.
There are, okay. So there's some in Dallas also. So, I was having a brief talk with a physician at the last conference that we were in, and I thought, it was my opinion, that they had a somewhat of a nonchalant attitude, that they thought this was a in and out kind of a clinic that anybody could walk in and get ketamine treatments. So, and when I say ketamine treatment, ketamine is also being used for the treatment of SSRI-resistant depression, PTSD, or anxiety, or like maybe OCD, or other form of psychiatric impairments. So I went into this clinic because I wanted to do some research just to see what we might expect to see when we see an insurance applicant applying for insurance and what type of records should we expect. So anyways, I walked into this clinic and I asked, they first of all greeted me and I told them why I was there for research purposes. And they greeted me with a 27-page questionnaire. So in the 27-page questionnaire, they had everything from my personal history and the previous, SSRIs or SNRI medication that I might have been on before, and asked me if I had cognitive behavior therapy before or not. So I didn't fill out the whole questionnaire, but I still have the questionnaire in hand, and I thought that was very helpful. And they also explained to me that there's a therapist during the session. So, and there's two ways of receiving ketamine. Maybe there's more than two ways, but the two ways in this particular clinic was intranasally. And maybe you could talk a little bit about what is this medication that's approved for intranasal use of ketamine.
Okay, well, I'm glad you brought this up because here's where I think we need to discuss for the insurance population. What is ketamine all about?
Yes.
So, as we talked about, ketamine is an approved drug for anesthesia. Now it's being used for possibly helping in people that have resistant depression, OCD, PTSD, as you said. So what's the difference? Why is this something that used for one thing is now being tried on something else? So how did they discover that it might have benefits, right?
Yes.
And as you said, it's usually for people that have been tried on SSRIs, which take a long time to work in the system, right? 4 to 6 weeks to get the benefits out of an SSRI. SSRIs kind of work on the serotonin in your brain or the norepinephrine. Ketamine works in a completely different way. So that's why it appears to offer an opportunity that wasn't previously available. So for anesthesia, you use big doses of ketamine, and it's given as a bolus, a big push at the beginning to put somebody in anesthesia. using it as a drug that might help with depression, it's used as an infusion, a lesser dose, a much lower dose, over a longer period of time. So maybe an infusion for 40 to 60 minutes under supervised conditions. Okay. So, as you said, there's a nasal form.
Yes.
Called Spravato.
Yes, I've seen Spravato.
Or it's called S-ketamine. Yes. So it has an ES at the beginning. And that's a nasal spray. And you are observed for 2 hours. And that is FDA approved for treating resistant depression.
Interesting.
The difference between the SSRIs and what ketamine may offer is that ketamine works very quickly. So even after an initial or a few treatments, people that were previously had resistant depression may develop a new way of relating to what their depressive symptoms were, and they are significantly improved. But as I said, the beauty of these drugs is they may work very quickly. And even people with suicidal ideation, not that we consider those for life insurance at the time, right? But it seems to have a very unique effect on changing the way people perceive where they are and, have concerns about suicidal ideation. So it may offer a real advantage in that kind of area. Here's why I think ketamine may offer an alternative and in some people offer some better experience for them, is because, as you talked about, in addition to this effect that we know about it, it seems to have an ability to change the way the brain works in a different way. And instead of working on serotonin or norepinephrine like the SSRIs,
yes,
it works on glutamate, which is a different chemical in the brain. So one of the main receptors that it works on, and I don't want to get too far down.
Oh, but I did not know that. That's fascinating to me.
I don't want to get too far down the weeds, but I think it's important to understand people that may be kind of like pushing this aside as just one of these new, hot drugs that everybody's using.
Right.
I think when you look at the science behind this, it may offer something that people aren't talking about right now. And I think that's why it's important for us to bring it up today in the podcast. These receptors work on glutamate, which offers a different way of allowing the brain to make new synaptic connections.
Again, the definition of neuroplasticity.
Exactly.
Comes into play.
So there's a lot of different kinds of receptors. So there's a lot of science below the surface on this that people didn't talk about when they were talking about anesthesia. But now that we're using it in the psychiatric domain, NMDA receptors are the ones that affect the level of glutamate. So there's other receptors. AMPA also work in a slightly different way, but still affect this glutamate in the brain, which seems to have this rapid effect.
Yeah.
Amazing.
I'll bet you that therapists are like, having interviewed like a couple of therapists and cognitive behavior therapists also and psychologists, they find it as a great breakthrough because they could spend months and even years with their patient and not have this type of breakthrough. And yet these folks, when they come in for ketamine treatment, it's not a regular occurrence. You don't have this on a regular basis. And you could have significant improvement with a patient over a 6 to 9 month period with just a few handful of treatments. So people don't use ketamine daily, right? Am I right to say that? Okay. No. So yeah. So
I think what we would consider in terms of psychiatric care, it's an abbreviated number of treatments.
Yes.
Because hopefully it works faster because it's working in a different way in the brain, as I discussed.
Right.
So I think getting in the weeds a little bit does help people understand, hey, this may be something new. Yeah. It also affects some more obscure ways that the brain actually operates because it allows these synaptic, so your synapses in your brain,
yes,
it allows an environment, a milieu, to allow milieu. I go in French.
Bien entendu, oui. Carry on, yes.
It allows an environment so that the neurons can work better together and in a different way. So this neuroplasticity
yes,
is something that I think we're going to want to think more about and discover exactly how these drugs are working. There's other like receptors that this works on, which I could discuss, which are even more, down in the weeds. But
down the rabbit hole.
I think leave it to say that it actually may affect reducing the inflammatory things that are going on in our brain. So, when you're depressed, you're kind of in a cycle of thinking the same negative way about certain things, about yourself possibly. Mm-hmm. This kind of allows a new way for your brain to function on a rapid basis. Obviously, it's not going to work in everybody. It has to be under supervised conditions.
And that's the key here. And that's the key. We won't talk about the elephant in the room, but why not? Because it's been in the news and we all saw the tragedy about Matthew Perry that was found dead in his home,
right.
and because of ketamine, and that was the headline,
yep.
And again, it was not the proper set or the proper setting,
right?
And he had multiple other drugs in his system as well, so it's obviously not recommended.
Well, I don't think anyone should be using drugs like this when they're in a hot tub,
right? Period.
That's it's for starters. That's probably a bad idea,
right?
He wasn't under supervised conditions,
correct?
So he was getting illicit administration of a drug that is only to be used in certain instances. So really, there's always going to be an example,
of course,
where something goes wrong, even with all the wonderful drugs that we have available. If people can find a way to take it
mess it up,
way. But to give you an idea how safe this drug is,
yes,
when people have a colonoscopy, these days, they don't want to feel any pain from the colonoscopy, right?
Right.
So there's a drug called propofol.
Yes.
So Michael Jackson overdosed on propofol.
Yes.
Any drug can be used in a negative way under the wrong circumstances in a dose that has no health-related benefit. So,
right.
But interestingly, ketamine and propofol are often used together in anesthesia because they're both safe under controlled conditions. And it's actually called Ketafol.
Oh.
Ketafol.
Okay.
Ketafol, because they mix the ketamine and propofol in either a 1-to-1 or a 1-to-2 ratio, and it can be administered so you get the benefits of the rapid action of the propofol.
Yes.
But there is a slight respiratory depression with propofol, so it has to be under an anesthesiologist watch.
Yes.
So you could administer both together, get the benefits of this fast-acting propofol,
yes,
and get the benefits of the longer-acting ketamine in anesthesia, which does not have the respiratory depression. So the two of them are used together very frequently in hospitals and wherever today. So they're both safe drugs, but I think the Matthew Perry and the Michael Jackson show any drug used in the wrong way is not going to have a good outcome. But
good takeaway, that's for sure.
But here, I think the benefit is that using these drugs under controlled circumstances in a select population might have beneficial results. And here's why we're interested, and we're talking about it today, is I think some of the companies we work with are going to start seeing applicants for life insurance that have gone to a ketamine clinic.
Yes.
And they've, we'll be able to get those records and take a look. I don't think companies should be afraid,
correct,
to take a look at these cases. And, we're obviously here to help any companies that have questions about the candidacy of these people for life insurance. But that's why we wanted to talk about it today. It's a new wave coming. I think it offers benefits that may not be available from the typical SSRI type drugs.
Right.
It works faster and offers certain benefits that might otherwise not be available.
I think that's a great conclusion. And I going forward, like we always have underwritten the underlying condition. So, for stability purposes, we would look at the form of treatment, we would look at the diagnoses, we would look at the medical records and how this person is progressing and ensure that there's stability in their diagnoses. And then we would apply and we would refer it to the medical director. You would see those cases also. Just for wrapping up, I believe that's it on ketamine today. Thank you, Dr. J. And thank you for enlightening us with ketamine.
I'm glad we got a chance to talk.
Thanks. Bye-bye.